Today, we are going to talk about metabolic syndrome. Many people believe that only obese or overweight individuals can suffer from high blood pressure, high blood sugar, or high cholesterol. But that is not true. Now, you might be wondering how can thin, young people who on the outside look like they are in a good shape develop high blood pressure, high blood sugar, and even high cholesterol? One key reason is body fat distribution. We call this phenomenon TOFI. Thin outside, fat inside. It describes individuals who look thin and healthy but have high amount of visceral fat which is stored deep within the abdominal cavity around important organs. This type of fat is more metabolically active. It means that it releases hormones and chemicals that can lead to insulin resistance, inflammation, and other metabolic issues, a phenomenon called metabolic syndrome. So what is this metabolic syndrome? It is a group of conditions that increase the risk of heart disease, stroke, and type 2 diabetes. You are diagnosed with metabolic syndrome if you have 3 or more of the risk factors that include high blood pressure, high blood sugar, excess body fat around the waist, abnormal cholesterol levels. Now, besides the abnormal body fat distribution that we just mentioned, thin person can also have family history of metabolic syndrome or genetic predisposition to insulin resistance or abnormal cholesterol level. Now, I want you to understand that having these genes doesn't guarantee that you will develop these conditions. Think of it as walking around with a loaded gun. It won't shoot unless you pull the trigger. If you can maintain a healthy lifestyle, you can significantly reduce your chances of developing any of these conditions. Another factor to consider is sedentary lifestyle and poor diet. Now, physical activity is absolutely crucial for maintaining insulin sensitivity and preventing inflammation. Exercise helps our muscles use glucose as a fuel. This will lower the blood sugar level and improve insulin sensitivity. On the flip side, a lack of physical activity can lead to buildup of fat in the muscle and in the liver and cause a condition called fatty liver. Now, I have a great article about this on our website, so check it out. When fat builds up in the liver, it will interfere with insulin signaling and cause inflammation. And of course, if your diet is high in sugar and processed foods, this will only add to elevated blood sugar levels and abnormal cholesterol levels. Now let's talk about the worst sugar to eat, and that's fructose. There are several types of sugars such as fructose, glucose, and galactose, and few others. But fructose has a much higher potential to cause insulin resistance and metabolic syndromes compared to other sugars. Fructose is found in fresh fruits and honey, which are good, but in our Western diet we find fructose primarily in high fructose corn syrup, which is used as a sweetener in many processed foods and beverages. Soft drinks, sport drinks, and other sugary beverages are especially high in fructose. Now, fructose is metabolized differently from glucose. While glucose is metabolized by all cells in the body, fructose is primarily metabolized in the liver. Consuming large amount of fructose can overload the liver. This will cause production of triglycerides and fatty acids, which over time can cause insulin resistance and metabolic syndrome. However, it's important to remember that consuming too much of any sugar, not just fructose, can lead to the development of insulin resistance and metabolic syndrome. If you want to see how insulin resistance can affect protein synthesis and what effect it has on building muscles, check out this video, which is somewhere down here.